Tuberculosis is one of the few serious infectious diseases that is actually curable. But the reality is, the journey to recovery is not always easy. TB treatment can last for 6 months or even longer. And during this time, patients often face physical, emotional, and lifestyle challenges. On World TB Day, we are bringing special episodes with the renowned doctors to get the maximum insights from them so that the patient recovery and the awareness into the masses can go ahead. And in this episode, we are going to talk about how TB treatment actually works, why it takes so long, what patients go through during recovery, and how nutrition and immunity play a critical role in healing. To guide us through this important conversation, we are joined by Dr. Gopi Chand Khilnani, sir, Chairman of Pulmonary Critical Care and Sleep Medicine at PSRI Hospital. Doctor, thank you for joining us and giving your time, sir.
Thank you.
So, sir, before we dive into TB treatment, I would like to understand your journey as well. What inspired you to specialize in pulmonary medicine, and what has your experience been like treating TB patients from over the years?
So, I'm basically an internal medicine person by degree, and at the All India Institute of Medicine, I took fancy for pulmonary critical care and sleep medicine under my mentor, Dr. J.N. Pandey. I realized that respiratory medicine is a very important part of medicine. Not only TB, but asthma, COPD, and then soon enough, I entered the field of air pollution also, really affects lungs. So it has been very exciting journey to be learning and practicing pulmonary critical care and sleep medicine, of which tuberculosis is a very important part. And if we talk about chest medicine or pulmonary medicine, history-wise it used to be called chest and TB or TB and chest. So TB has always been a very important part of pulmonary medicine, but now it has expanded.
Sir, as you said in your introduction that you have learned for air pollution as well. So the common challenges now, not only the TB patients are facing, but a normal healthy person is also facing due to the air pollution. What is your take on it?
So air pollution is affecting us more than what we actually understand. And the Delhi is the capital of India and capital of air pollution.
Yes.
Also. That includes Delhi NCR. That means Gurgaon, Ghaziabad,
Yeah.
Faridabad, Noida, and everything. Now it not only affects lung, but actually it affects our longevity also. The Chicago study which got published in October 2024, it actually revealed that our life expectancy in India is coming down by 5.3 years only due to air pollution.
Oh.
And a Delhiite lives 11.9 years less because of air pollution. Even if you take it as an overestimate, not only the quantum of our life is affected, but the quality is also affected. And we have seen it all. As the Diwali comes, your throat starts irritating, your running nose, your eyes start smarting, you start coughing, you feel tightness in the chest, you feel tired in the evening, sleep gets affected. And so much so that people can't even complain for that because everybody is affecting this. As far as the hospital is concerned, we get more admissions, more OPD patients, more ICU patients, and we see more patients not responding to usual treatment of for asthma or COPD or pneumonia. So I can keep on talking. It not only affects lung, but it affects heart and brain and everything, strokes, diabetes, and so on and so forth. So that's a different subject altogether. But it is also proven now that air pollution affects tuberculosis also by virtue of damaging the immunity of the lung by causing bronchitis and COPD. Tuberculosis also becomes worse or more likely to it happen.
Sir, as you said that tuberculosis also worse. So I would like to dive into now the treatment process and how does treatment work for TB. So could you please decode a little about this in a very simplified way? How does the treatment happen?
So tuberculosis is an infection. Like you treat bacterial infection, sometimes you give antibiotics for 7 days or 5 days or at best 10 days, 14 days. But tuberculosis treatment is longer, minimum 6 months, and it can go more than 6 months also, especially for extra pulmonary tuberculosis. Why it is so? This is because the bacteria may multiply every few minutes, every few seconds or few minutes. But the tubercular bacteria, what is called mycobacteria, takes 18 to 24 hours to multiply.
Okay.
So, so because of that, it takes longer to kill the bacteria. That is one. Second thing is that mycobacteria can be active, like in lung tuberculosis. There can be in an area where the medicine does not reach, like in a sufficient quantity, like bones or in the brain. And also there are bacteria in the cells, intracellular bacteria, where the medicines are less effective. And there is something called dormant bacilli.
Okay.
That bacteria are dormant for years together. It is very difficult to kill them with a short term course. So the treatment has to be longer. Now, what happens that when you start treating a patient, in 3 to 4 weeks starts feeling good. His fever goes away, maybe his cough stops, his hemoptysis, that is spitting blood, also stops. He starts gaining weight. So he feels that he has become normal. So, and quite often they stop the treatment without
Yes.
going to the doctor. The result is that it recurs, and then this TB is more likely to become resistant.
Okay.
So when we say 6 months, it is based on the studies. Whenever the researchers have done studies to try to reduce to say 4 months, there is higher chances of recurrence.
Okay.
So 6 months is not sacrosanct. As I said, that if the TB is of brain, TB is of bones, TB is of covering of the heart, what is called pericardium, then it is recommended it is given for longer time also. So summarizing it, that treatment of tuberculosis is longer and multiple drugs are given, and there are various side effects of drug which have to be monitored. At the same time, the nourishment of the patient is also important.
So, you talked about some kind of medicines. So, what usually kind of medicine prescribed by the doctors for the TB patient, whether it is of bone, heart, or any?
So for a usual kind of tuberculosis, there are what is called a first line treatment.
Okay.
So I'll name them, although it may not be very important. One is rifampicin, and second is isoniazid. These are the most potent, most powerful anti-tubercular drug because they are bactericidal, that they kill the bacteria. And there is another drug called pyrazinamide, which actually works in the acidic environment. So it has got a special characteristic. Only on strength of pyrazinamide, the duration of treatment is reduced to 6 months. There's another drug, fourth drug is ethambutol, which is which is not so bactericidal, but it reduces the chances of resistance when given with these drugs. And fifth one is injection streptomycin, which is usually not given as a first line drug. So these
Okay.
are the drugs which are given, and all these have their side effects. They are quite a big tablets. So we can talk about side effects, but what I want to say is that since 1993, it is recommended that in all cases of tuberculosis which are newly diagnosed, all the four drugs are given in the beginning, and after 2 months, pyrazinamide is stopped, and rest of the three drugs are continued for the 4 months or 6 months, or not, depending upon the case to case.
And sir, the treatment for all the TB patients are same or it differs accordingly to the patient?
The treatment for all the TB patient to start with is same. So before I go into that, the tuberculosis is one is drug sensitive tuberculosis. There is something called MDR tuberculosis.
Yes.
So MDR tuberculosis is defined as when there is resistance to rifampicin, with or without resistance to other first line drugs, which I have already said, then it is called MDR tuberculosis. Now, MDR tuberculosis is a very serious uh, issue because once the MDR occurs, the chances of cure are reduced, and something like 52% or maybe more, 60%. The drugs are entirely different. The duration of treatment sometimes has to be very longer. So, first I will talk about, and it is very important for everyone to know as to when you give first line drugs, which is more commonly given, what are the precautions one has to take?
Yeah.
What are the side effects and what is the. So, when you give medicines, there is a method of taking, like rifampicin has to be taken empty stomach, first thing in the morning, and for next 45 minutes, then nothing should be taken, not even tea or coffee or people are used to just take it and for 45 minutes. Then
Yes.
you take your breakfast and take rest of the medication. This this medicine is a brick red color, so your urine and tears and every secretion will become red. So person, unless we inform the person, he'll get scared कि blood आ गया urine में.
Yes.
And till the time you take rifampicin, especially during the forenoon or before lunch, it clears out and color becomes normal, not to be worried about. Some people get a flu-like symptoms with that. And all these drugs called gastric irritation in the form of nausea, sometimes vomiting also. But the most important side effect of these rifampicin and isoniazid and the pyrazinamide is liver injury. That is jaundice.
Okay. I was
So,
about to
which
ask you about the side effects and
side
the
effects?
same.
So, I am coming to that. So, it is important that we warn the person if there is a severe loss of appetite, if by looking at food he feels nauseated or even thought of food become nauseated, he is unable to eat, if he is vomiting, if there is a pain in the upper part of the abdomen, so there is more likelihood that he is getting liver injury because of these drugs.
Oh.
The chances of getting liver injury in India, Indian setting, are something between you can say 3 to 7%. So sometimes 10%
So
also.
why did you
So while
especially quote Indian? Does this differ region to region?
yeah, as far as the Western data is concerned, chances are 2%. And in
Okay.
Indian data is concerned,
Why
and
does
where
this happen, sir?
so the reason for the liver toxicity is more if the person is elderly, if his body weight is low, or his proteins in the blood are less, or his disease is more extensive, or if he is taking alcohol, or
Okay.
if he is underlying liver disease from before, then, and there is some data says that it is more, liver injury is more in females also. So these are the reasons we call as risk factors for hepatotoxicity, and we conducted a study at All India Institute of Medical Sciences where we found that 7% incidence was there with this combination of
7%.
first line drugs. So it is important to inform the patient that their likelihood of liver injury. So we baseline we do liver function test, advise them not to take alcohol for the condition that they will be on antitubercular treatment. And I'll talk about diet. And if they get this kind of symptom, then they should test for liver function test. Usually we advise them to do liver function test every 15 days for first 2 months and then monthly thereafter. But it is not mandatory because it is not possible at village level and
Yes.
to do blood test. But whosoever can afford that and is in the city, we advise them to do these tests. Besides that, there are there's like isoniazid, which can cause some burning sensation or nerve involvement, and all these drugs called liver injury also. Pyrazinamide, which is a very strong first line drug, as I told you, it works in the acidic environment.
Yes.
It is notorious for causing joint pains.
Joint pains.
Yeah, and which is because the uric acid goes up
Okay.
because of the medication. So if the uric acid goes up, then we have to advise them to take some medication, which I will not recite at this here. And ethambutol is one rarely causes eye toxicity.
Eye toxicity.
Yeah, so person does not recognize red and yellow color, and his vision goes down. So I must tell you that this is irreversible
Okay.
largely. So it is very important to inform the patient to keep checking keep an his vision. That when
Yes.
if he has a visual disturbances, we do not advise regular eye checkup because it is very uncommon
Yes, yes.
side effects. So summarizing it, that these and 10% of the patient will get some skin reactions. Skin reactions in the form of itching and redness. All this does not require stoppage of medication. It is very
Yes.
important to continue with the medication. However, if the liver injury occurs,
Yes.
if the, then the medicine have to be stopped for some time, and other medicine which are not toxic to the liver are given.
And sir,
So this is about,
as you said
yes.
that some medicines can be stopped. So when this medicine stopped, when having some kind of infection in the liver, does it affect the TB and worse it the case?
Yes, it will affect the TB, but rifampicin, isoniazid, and pyrazinamide have to be stopped. Ethambutol does not affect liver; it will continue. Then we add two more drugs called moxifloxacin or levofloxacin. These are quinolones which are not hepatotoxic, and also we give them injection streptomycin daily till the time liver recovers. And then we again give them the same medication. Usually it is well tolerated over a period of time. So this is about the side
Side effect.
effects of.
I would like to ask one
No,
more side effect, sir. As you
yes.
talked a lot about the side effects. So, in this side effect, does some sleep cycle of the patient also, you can say, hindered? Or because the mental challenge and the physical challenge the patient is going through. So, does it affect the sleep cycle to the patient?
Not really, not directly it affects the sleep cycle. It affects the nourishment of the patient. Because of the nausea, the person may stop eating, is vomiting. So that can, if I go into the intricacies, that the second line drugs, they're called quinolones or levofloxacin, moxifloxacin, they can cause insomnia.
Okay.
The person does not sleep throughout the night. But for this program, we will not go into the
Medical terms.
intricacies because it is
Yes.
for the general. Here I would like to emphasize about the role of what other advice we give about the food habits,
Yes.
about the diet. So, while treating patient with tuberculosis, diet is extremely important because loss of appetite and weight is a symptom of uh, tuberculosis, and also quite a few patients are undernourished,
Okay.
and that is a cause and also the effect of tuberculosis. Meaning that people who are undernourished are more likely to suffer from tuberculosis. So it is very important that they should take a good protein diet. With that, what I mean is that, like, if somebody is vegetarian, then he can take milk products, dals. and sprouts, paneer, tofu, all these are good sources of protein. And if they take egg is a very good source of protein. They should not fry the egg. They should take boiled egg, and non-vegetarians can take mutton, chicken, and fish. They are good sources of good quality protein. Since they have loss of appetite and they are taking heavy sort of medication which themselves cause nausea, they should, with conscious effort, take small helpings of a good protein diet. It is important to take fruits also,
Okay.
and so that they get good vitamins as well as their appetite improves. And fruits are, as we know, that they are very good for health. It is important to tell about the diet, that sufficient calorie intake should be there. Even if they are not feeling very hungry, they should take small feeds. And all these patients who have lung tuberculosis should wear a mask for first 6 weeks till the time they become sputum negative.
Okay. Sir, as you said that calorie is very important. So nowadays whenever we hear about calorie, everyone say that it should be this much amount of your weight, it should be like this, it should be like that. So how much quantity of calorie should a TB patient and a healthy patient should take?
So calorie as for anybody 25 to 30 kilocalories per kilogram of body weight. The protein should be 1.5 grams per kilogram body weight, maybe up to 2 grams. A normal person requires 1 to 1.2 grams per kilogram body weight, but the TB patient, I would say, they should take 1.5 to 2 grams per kilogram body weight, and dietitian will be able to advise
Yes.
how to make it up this amount. But even if you don't have a help of a dietitian, the foods I have advised, they if they take it in a good quantity, which will help in the early recovery and better recovery from tuberculosis.
It means a good nutrition speed up the recovery and makes a difference in the TB recovery. Yeah.
Yes,
And sir, what is the biggest mistake TB patients make during their recovery?
as I talked about MDR tuberculosis, which is when I started career
Hmm.
in 1991 in this field. Maybe you were not born at that time. So there were articles saying that MDR-TB is like a death sentence
Oh,
because there was no hardly any treatment for that, and they were, treatment used to be for 18 months and 24 months with very little success. Why does MDR occurs? MDR occurs mainly because there is a non-compliance to medication. Either the medications given are faulty, or they are in the smaller dosages, or they are prematurely stopped. Now, the biggest mistake one occurs that person starts feeling good in 3 weeks time, 3 to 6 weeks
yes.
time. Yeah. The fever goes away. He feels very active. He believes that he has got a new life. He starts jumping with joy, and he stops treatment. And this is the most common cause of genesis of multi-drug resistant tuberculosis. Now, come to think of it, a person has developed multi-drug resistant lung tuberculosis.
Hmm.
He keeps on moving into the community. He goes to office, he goes to school,
Yes.
he goes in the bus, he goes in the elevators. He's spreading it.
Oh,
So he's spreading it to the person. Now, the person who has never taken anti-tubercular drug, he has developed MDR-TB at the outset. That is called primary MDR tuberculosis.
okay.
The person who has taken medication and develops MDR called secondary MDR tuberculosis.
Okay.
So one of the main causes that the person stops treatment. One cause is the prescriptions are faulty. That is, somebody is 80 kilos and he gets the same tablet which is given to 40 kilos person, then his regimen is suboptimal. So if you can put it this way, that if you are fighting an enemy, if your armamentarium is weaker, then the enemy becomes stronger. He
Yes.
comes out stronger. So similarly, if you are instead of 4 drugs, if you are giving 2 drugs, or in the lower dosages, or the person is taking intermittently,
Yeah.
or he stops, or suppose he has diarrhea, the medicine is actually not absorbing,
Oh.
or he is vomiting. He takes it, but he throws
Yes, he
out.
threw up.
Or his absorption is not correct. He has some abnormality in the gut uh, that is that it does not reach the blood. Then these patients will develop MDR-TB. So, what patients should do is that they should take their medicines regularly. If they have side effects like liver injury, or they develop itching or rashes, they develop joint pains, then they should consult their doctor. And one of the reasons in India is that people, when they don't become better, or they suddenly think that they should go to another, uh, you know, medicine, uh, what we call as homeopathy or Unani or Ayurveda. I am not against that, but if you are following tuberculosis treatment, then that should be continued. You know,
Yes.
so this also happens commonly, and these are the reasons that one should be careful about. And what we do is that we periodically test sputum to see that the person has become non-contagious and he has responded.
Yeah.
And once he becomes non-contagious, then he can go into the community without a mask and lead a normal life.
Got it.
Besides that, a good hydration, good fruits, good juices, all those are very
Nutrition.
important.
Yes. So after TV treatment, sir, can a patient live a completely normal life?
Yes, if the person has had drug-sensitive tuberculosis, he has taken complete treatment, he has a normal life. However, if the treatment is incomplete, there is a high chances of recurrence and also him developing secondary multi-drug resistant tuberculosis.
Yeah. So before wrapping up the session, sir, there is one segment, truth or myth. So I will ask you a short question about that, and please tell us whether it is true or false with a brief description about the same. So first question, most of the time patient hide their TB diagnosis, and that actually increases the speed. Is it true or myth?
So first thing is partly correct that patient do hide their diagnosis, but no more as much as it was 30, 40 years back when it was considered a stigma. Because olden days it was said that only poor people living in a crowded environment they develop tuberculosis, which are undernourished, and but now we know that it has spread so much that all strata of people, richest of the rich and the well-to-do people, also develop tuberculosis. It is purely 100% curable, so it is not a stigma. But some people may hide it, but it has nothing to do with the recovery from the
Yeah.
patient.
My second question, sir. TB medicines are so strong that missing a few doses doesn't really matter. Truth or myth?
It's a myth, of course. I've already detailed it that
Yeah.
regular treatment will lead to not only the uh, non-response, but it also will lead to the genesis of multi-drug-resistant
Yeah.
tuberculosis.
Third question. Good nutrition alone can cure TB without medicines. Truth or myth?
Never, never, never. It cannot. But having said that, in olden days when sanatorium treatment was there, then some people used to recover with only fresh air and good food. But then their lifespan went down. At some stage, the recurrence was there. These are data. So the answer is big no.
Okay. TB patients should completely avoid physical activity during treatment. Truth or myth?
No, that is not correct. The first few weeks, it is good to take rest because the tolerance of medicine is difficult. They have a lot of symptoms of fever, cough, and weakness, evening night sweats, and all those things. So they may not be able to perform normal activity. As they start feeling better, then they should do normal activity, go do their work, whatever they are doing.
One last question to you, sir. Once TB is cured, the patient can never get it again. Truth or myth?
No, he can get it again. There are two things about it. One is new infection, another is recurrence.
Okay.
New infection means he again gets an infection from another source, and second reactivation is the same infection which was inadequately treated or was dormant. It comes. So not much data are there. There is almost equal chance for anybody developing tuberculosis as compared to, but some data say about 2% chances are there that there will be recurrence. For all practical purposes, a person once cured will not develop tuberculosis again.
Okay. Thank you so much, doctor, for sharing your
My
valuable
pleasure.
insights with us today. As we have learned, tuberculosis is curable, but recovery requires discipline, patience, and proper care. The key takeaway from today's conversation is very simple. Completely Completing the full course of treatment and maintaining proper nutrition are essential for a successful recovery. With the right approach, patients can recover fully and return to a normal life. Thank you for watching MedGate Today World TB Day Awareness Series and joining us today. We hope this conversation helps spread awareness and support those going through TB treatment. Thank you so much, sir. Namaskar, sir.